this meeting of the Social Work and Social Care Board, which has been conducted from the Council chambers and remotely through Microsoft Teams. The meeting is now being recorded and will be made available on the COAL's website following the meeting. So I'm sure you're all aware of the usual housekeeping about mobile phones, etc. And so, further ado, we'll carry on. And first item on the agenda is the minutes, and it's the minutes of the meeting 25th of November 2024, and they are for approval. Everybody happy with them? Okay, thank you very much. Declaration of interest. Members are asked to declare any interest they have in any items on the agenda. It would be helpful if members expressed why they are declaring an interest in the item concerned. So do we have any declaration of interest from anyone? Anyone online? No? Okay, thank you very much. Corporate matters. Outcome Delivery Report. This report is for noting and details the half-year progress of the 2025-26 departmental strategic priorities for the Health and Social Care Directorate aligned to the department. An update on departmental key areas of strategic risk is included, along with progress on the strategic outcomes and the resources identified to implement the business plan. And Emma will speak on the report.
Thank you, Chair. The format's the same format we've presented previously, but just to reiterate what's detailed in the report, we do give quarterly updates on actions pertaining to the outcomes we're addressing through Interplan, and that's accessible publicly. The risks that are identified at Section 6, and they'll be familiar to those of the elected members that have engagement with the department: workforce and balancing unmet need and prioritising service delivery based on the capacity of the services we have. And Section 7 goes on really to share how we're addressing the challenges that we've encountered in this reporting period, as well as the successes. I think those who are in the chamber today and online are familiar with the situation that happened regarding the HC1 nursing home and how we've managed to handle that successfully to retain the workforce and support the residents on Eilean. That was not without its challenges, but the transitions have been completed and completed well. We continue to offer the self-directed support options. And in terms of service performance, in 7.6, you can see the grading of inspections that we're receiving for our services. So that is really encouraging in terms of the standards that we're providing. The resourcing of the plan, the IGB is responsible in terms of the pool budget, and the structural deficit has been identified in a savings plan put in place for this year, and there's work ongoing through the budget setting process for the next period, next financial year. And you'll also be away through COSLA briefings and others. The structural deficit facing IGBs is subject to national discussion as well. Happy to take any questions.
Okay, is there anyone got any questions for Emma? Angus?
Thank you, Chair. I mean, just first of all, to congratulate Emma on a recent appointment. I think it's been a sort of a better person for the role, and glad to see you there, Emma. And I think things will go forward and strength to strength now that you're in that position. It's really to do with the risks. I was going to ask a question. One of them was staffing. Could you elaborate a wee bit on the staffing in the care homes, Emma, at the moment? I know with the new care home, we were struggling at the beginning to get staffing in there. And the follow-on from that, obviously, is, with the staffing, with the Bladboya move into Seaforth House, the limitation that may have given us for bed space in care homes going forward, and how we're going to mitigate that, given that we're an ageing population.
So workforce, there's a number of actions that we have in play at the moment. short, medium and longer term in terms of addressing the workforce challenges. And I think, Chair, it would be useful that IGB have a report tomorrow on delayed discharge and unmet need, and a lot of them are documented in that report, and I can circulate that to the membership because it will provide the detail you're wanting. And it's everything from looking at how we're supporting people with single-handed care to reduce the double-up care and maintain the independence and the mitigate the number of people that are involved in somebody's personal care for the benefit of the service user and the service. We've got training going on, and it's called Moving with Dignity. So it's new moving and handling techniques with different pieces of equipment. And that was really well received by the staff group. There was 32 trained last week, and we're meeting tomorrow in terms of the rollout for that. So that's, you know, a short, medium term action, but the longer terms, we're working with the Major Developers Forum on recruitment, you know, looking to see in terms of the potential families and workforce that are moving here so that they're well sited on the opportunities we can afford them. We've also been looking at skills mix and services. You referenced care homes, looking at how we have assistants, workers and seniors on shift patterns so that there's a blended skills mix, as well as the rotations that we have, the scheduling of the workforce, so that the work-life balance for individuals is factored into our planning. But as the report details, we are refreshing our workforce plan, and that'll be coming to the corporate management team and integrated corporate management team, and that'll give a holistic view of all the different actions, because essentially it's around workforce, but a lot of it is to do with, you know, we're impacted by our geography, but also the sector challenges that are being faced nationally. In terms of the transition, the HC1 staff transition to Bremner Court, the housing with extra care service, but we have, as a system, lost 38 nursing beds, and we're working with Scottish Government looking at different models of care, but we're also looking at future expansion of a residential and nursing service. Now that's got two issues. There's the capital investment and the revenue investment, but that is part of the discussions we're having. That's more for the medium longer term. But what we do is when there's people assessed for a service, we endeavour to ensure that all opportunities are considered on island, and we haven't had any out of area placements as a result of the changes to the system.
Thanks for that, Emma, and I appreciate these comments. I was just going to ask, I know it's a year since this board met last, probably a year just now. Is there any way that we could probably get some of the information that you relate to from the IJB fed into members who aren't on the IJB, who are on this committee? I think that would be beneficial going forward, and we could view things, because I think from this board, I think we're kind of, I wouldn't say in the dark, but we're not aware of what is going on. There is good stuff going on. You know, there is good stuff going within the IJB, and it'd be good to know what is happening, even fed into this board if possible. And the other question I was going to have was going forward. I know you'll be aware yourself that initially, before the new care home was being built, we were talking about 2 care homes. We're talking about another second care home for Rolla Lewis. Is there any way that can be progressed through government, or given the shortage of bed space that we do have and the pressures that we may have going forward, is there anything in the plan in the future to have a second care home in Rolla Lewis?
So that's part of the discussion with government, is the future resourcing, but there's significant capital issues. We know that the Lewis Residential Care project didn't progress this capital programme due to the capital availability was one of the factors. But we have to be realistic in terms of workforce too, the challenges of recruiting. So these two things need to come together before the next capital programme for a proposal. But the location isn't the discussion at the moment. How we resource and how we build on what we have is, but that will follow for the next capital programme.
Thanks for that. Thank you.
Thanks, Chair. Just following on from Councillor Morrison, I'd like to congratulate him on, the promoted post that she does have, and I hope all goes well. I was at a breakout session at COSLA last week, and social care was discussed, and particularly, delayed discharge was considered, and it was fascinating, the figures they did come out with, that it was twice as expensive to have someone in a hospital bed as a care bed, and then it was a quarter of the cost of hospital at home. You see, percentages, that's what they were saying. So I thought myself, you know, how many reduced beds are in the hospital now compared to when the hospital was built, when we're looking at bed space and where beds, additional beds could become available, you know, with very little additional costs, because, you know, those wards were designed for having some form of patients in them. Any idea how many bed spaces have been lost in the hospital?
I can't answer that directly, but I can give you, in terms of the current situation, the hospital is staffed for the bed spaces that are operational. The historic budget associated with the hospital when it opened, for example, the budget has changed with the staffing model. So there's also, in terms of the budgeting for delayed discharge, there's notional costs and there's actual costs. So I think if you look at the reports to the IGB, the Chief Officer's Finance Officer's comments clear on what's a notional cost, and that's a per bed per day rate. But the actual cost differs to that. It's not as if you could just take that money out of the system and commission something else with it. So as much as these figures are spoken about, it's a very complicated matter. And the other thing to see is that somebody who's requiring social care, you do not want them to be cared for in a hospital if it's social care they're needing. That is not the environment. And the direction of travel, as noted in the report, is expanding community rehabilitation. So as soon as someone is medically fit and stable, that they will receive the rehabilitation in the community. And that is the way to go in terms of the person regaining their independence and being supported in a homely environment if they can't go home. We have, for example, the START service that provides rehabilitation in someone's own home up to a certain eligibility criteria. But this is talking about expanding that further and it potentially be community bed spaces. So that would ensure that then the hospital is for people who need a hospital and that we have other resources available in the community for people who need rehabilitation. And we know if you provide good quality rehabilitation, it can reduce the dependency on ongoing care in the immediate to the longer term as well. So that's really the situation as it is at the moment.
Tom, you want to come in?
Thank you, Chair, and congratulations to you in holding a meeting, and congratulations to Emma for her promotion as well. Following on to Angus Morrison's thing and the question as regards care homes, I don't suppose you'll get any update on the new care provision for Baraima. I know we've just raised it up kind of earlier, but I think we should also raise it at this forum. And the care home at Prianich is in major need of more than a lick of paint as well. So I don't know if there's any work to be looked at on what is next as work to be done to care homes, but you know, there's also there's a lot of work to be done there. So.
In the last half hour since I saw you last, I haven't had an update on Barra. But if I can answer your second part, and Chief Executives on the call who might wish to speak. But in terms of our care home estate, we have a programme of asset maintenance in place that looks at the condition of assets. So if there are requirements to be done, infection prevention control or the fabric of the building, they are considered and resourced. We have inspections pending public release in terms of Trianet, which were quite favourable. Yes, it's not, for example, the standard that the space alignment of spaces isn't what you would build today, but the inspection was very positive, and I think you'll enjoy reading that report when it comes out. So in terms of the environmental factors in our care homes, if things need to be done, they're done. It's somebody's home, and the standard that we provide within the limitations of the footprints of the building we're operating, we will take action and address these.
Thank you.
Is that okay, Tom?
well, so I would have liked to have something on the Barra Care facility to where exactly we are at, or where we're hoping to be. You know, it's the talk is the clock is ticking on what's going to happen there for the campus project. So, and it's just a big part of it.
Thank you. Thank you. Is there anyone else? Any questions? Got a quick question for you, Emma. How are we for agency staff? Are we employing a lot of agency staff just now through home care, etc.?
We use agency to support packages that we've committed to pending recruitment, and we are reliant on agency in some areas. But that's part of the workforce plan as we recruit to reduce that. But the balance is, of course, with the demand for services, how you manage that finite decision making in terms of offering new packages as well as sustaining the ones that you've got when you have agency in the mix. But it is the last resort in terms of use of agency. But we do use them.
Thank you, Sat. Everyone, anyone other questions? Okay, thank you very much. Thank you, Emma. Yeah, yes. Are we all happy to note the report? So item 4 on the agenda, and it's the Chief Social Work Officer Annual Report 24-25, report by the Interim Chief Social Worker Officer. This report concerns the annual report of the Chief Social Work Officer on the statutory social work activity undertaken during the reporting period of 1st April 2024 to the 31st March 2025. The annual report is a means of reporting on the delivery of social work services for local authority areas, highlighting key activities, developments and challenges. Michael Stewart will speak to the report and answer members' questions. Thank you. Michael.
Thank you, Chair, and good afternoon. As said, the annual Chief Social Report relates to the last reporting financial year, the 24-25. There's a nationally agreed template for that report for all Chief Social Officers across Scotland, which includes information on governance and accountability, service quality and performance, resources, workforce, and looking ahead. The next stage for the local reports is they're submitted also to the Office of the Chief Social Work Advisor to Scottish Government, where a national report will pull those together to come to a national summary of social work performance for the financial year. In terms of what is a 23-page report, I'll take out some of the key messages. Really across the social work services that they have met the statutory requirements across children's, adults and justice social work throughout the reporting period. Improvements and developments have been made within that reporting period in spite of a challenging context of increased demand, increased need and some reduced resources. Social work services across the spectrum have had challenges related to vacant posts and recruitment at times. However, within the reporting year across services, the staffing has otherwise remained relatively stable. Both adults and children's social work managed to recruit social workers through the trainee social worker opportunity available through the Comhairle, which is considered a big step forward for us and a very positive step. I think in terms of summary across the report, in terms of adult services, the main headlines, you've already heard some of them this afternoon already, which was in terms of the ongoing development of the use of Seaforth House at Comhairle and the residential facility there and how that's progressed. Obviously, the biggest element for the course of the reporting year was the closure of the 38-bed care home in Stornoway, but the successful integration and care of those residents locally. But also within adults, the positive improvements within the reporting period recognised by the Care Inspectorate within their progress review relating to adult support and protection services. There does continue to be an improvement plan that's monitored by the Adult Protection Committee. However, the recognition from the Care Inspectorate was significant in terms of that improvement. Within Justice Social Work Services, over the course of the reporting year, we managed to appoint to both team leader and the vacant social work posts that had been extended periods where it remained vacant, which is a big step for a small service. And really in terms of the implementation of bail supervision services locally, as well as during the reporting year, there was justice social work completion of supported self-evaluation of justice services in partnership with the Care Inspectorate, which the service received good feedback upon. Within children's services, there's a lot of detail in the full report again, but again, the main highlights about the opening of the supported accommodation resource within Stornoway and Keith Street, the development and construction work of the Western Isles Bairns House over the course of the reporting year, and as well, the main stories around the challenging Care Inspectorate inspections relating to fostering, adoption and continuing care, where improvement planning and coordination is continued throughout the year and continues now in terms into this reporting year. The section on looking ahead sets out where there are still some areas for development and improvement, as well as what the potential challenges are in the current reporting period. And overall, the report pulled together is that the social work is performing within a very challenging context. Happy to take questions. Thanks, Chair.
Is there any questions from anybody? Nobody? That's very easy, Michael. Oh, sorry. Paul Steele, leader.
Thank you very much, Chair. Are you hearing me okay? Can you hear me okay in the chamber?
Hi, Paul. Can't hear you, Paul.
I can hear you, Paul, but I don't think the chamber can.
Okay.
I'm here too, Paul.
Yeah.
I think we're
Hi, Chair.
back on.
Can you hear me now,
I think
Chair?
we're back. Yes, I can now,
Yeah.
Paul. On
Excellent.
you go.
Thanks very much. Thank you. Thanks for the report. My question was just related to the promise. Obviously, there's been a lot of press around keeping the promise and the progress to date. It's not an easy thing to do with the funding in place to support it, but I just wondered where we are in terms of our commitments and keeping the promise.
Yes, thank you. In terms of the board will note that there's the Promise annual report was published recently in terms of the course of 24-25, which set out also some national challenges about the Promise implementation. I think in terms of some of the developments that have taken place locally is that we have seen both similar successes in terms of trying to implement the extent of the promise locally, but there's challenges about that in terms of resources, in particular in terms of some of the aspects of early intervention and prevention, as an example, become very challenging to do when the acute protection end of business is the part that takes up most of the resources and capacity of any service. That's the case across Scotland as well as locally. So part of the challenge of implementing the promise is about implementing what is essentially, nobody would disagree with what the promise is trying to do for our young people locally, but the challenge is doing that without any additional resource to be able to accommodate that. I think its early days would largely be the story of the promise implementation locally, but with a keenness to see that implemented and developed further within this reporting period with some of the aspects of wider care that's taking place. The development of the Bairns House is an example of where it will help us meet the commitment of the promise locally to our children and young people to make sure they're getting the best services available from us. In terms of myself as Oversight of Chief Social Work Officer, I have a clear link within our Education and Children's Services, but I think if there's more detailed information required on the promise and the implementation look, it probably need to come from the Education and Children's Services staff themselves.
Thank you. Chair, move to come back. Yeah, sorry, just to say thanks for that response. I think there is an awful lot of good work happening across the patch, but you're right, resources is really the issue that we're having to to grasp and tackle. So we'll keep making that case. But yeah, it'll be useful to see from education colleagues how they're seeing it from their point of view. So thanks very much for that.
Thank you, Paul. Thank you, Michael. Is there any other questions? I think you put it down. Tam, did you have your hand up earlier, or was it just to say that you couldn't hear us? Or?
I did hand my hand up and then had a bit of a rethought, but I was since you've insisted I ask a question, I was going to ask Michael if you know, that he mentions resources on that. How many social workers do we have at the moment, and are we fully staffed?
Yeah, thanks for the question. I don't have the detail of exact numbers, unfortunately, with me today in terms of the aspects of the Chief Social Officer annual report. Generally, they weren't looking for data and figures. They were looking for broader brush within the report, as you can see. What I can say is across the three services, I think numbers aren't quite as key as it is that there's certain posts that seem persistently difficult to recruit to. Certainly some of the senior leadership posts across social work services, particularly within children's services and within adult services. So giving an example from my own portfolio, which is the lead officer for adult support and protection and mental health, I think we've been out to advert over 15 times for that consistently without any suitable candidates being identified. So the number isn't necessarily the only thing that causes challenges. It can be that it's a particularly difficult to recruit to posts that makes service delivery really challenging within different teams. My understanding at the moment is that children's services have successfully recruited locally into the vacant post that they had. We have one social work post and two social care assessors that I'm aware of within adult services at basic grade level that we're seeking to recruit to, and we have candidates that we're leading at the moment, still to go through process, and justice social work is fully staffed. There may be other posts that are vacant within children's services that I'm not aware of, but that's largely the broad brush without an actual figure. But really just to make the case that it can be the case that one post being really difficult to recruit to has a big impact on a small team and on a small service, but particularly on a management team that's already at quite a low number already. I hope that's helpful. It's about as much as I have with me today. Thanks.
Yes, thank you, Michael. Yeah, it's very, very concerning, and we're always getting various feedbacks as regards that. So thank you.
Thank you, Tam. Any more questions?
Thank you again, Chair. I mean, it would be amiss of me to ask a question on finances in the thing, but I'm not going to go into the underspends and overspends. I fully understand mainland placements, and I'm not going to open that up today at all because I fully understand the position there. But the home care service is one area where I would like to get a bit of detail, where we're saying there's an underspend for the reporting period due to the level of vacancies within the service. A wee bit of detail maybe on the impact of the lack of staff in certain areas. Is there any specific area on the islands that are struggling at the moment that we haven't got agency staff in to fill? Or is it well complemented with our backup staff? I haven't had any complaints in my own ward, thankfully, at the moment, but I'm not sure what it is like in the general Western Isles area.
So we are addressing some areas that are have significant recruitment challenges, and the hottest area at the moment is Stornoway and Broadbay. And we're using agency staff to supplement the team there, because you can't have an underspend in such a service and be able to manage that to the degree without having some additional resources put in. So that's why we're using agency.
Do we know how much we're spending on agency, Emma?
Yes.
You know, I mean, I don't want you to open up just now, but maybe you could share it with the members of the board at a later date, maybe. You know, in comparison to if it was our own staff, what, you know, I know the rate is considerably higher for agency staff, but it's a percentage of that cost that would be good to know.
It's an interesting ask, because you have to really work through what the outcome you're wanting from knowing that is, because we're within budget, and also we're only using agency when we can't recruit through the traditional for our own to employ the workers ourselves. Agency is significantly more expensive than in-house. We know that. And what we're doing is an exercise in terms of the agency workers to be very clear on how many we need to recruit to eradicate the use of agency. Now, we can't do that in one recruitment attempt. We know that, so it'll be incrementally working back. The monitoring of the budgets is done monthly and it's reported quarterly to the IGB. That's the process in terms of it. And the Chief Finance Officer provides a narrative on that. And I'm happy to share that detail with elected members if they so wish. And we can give you indicative agency rates, of course we can, per hour, because you can use different agencies at different times. And the hourly rate that we pay our staffs in the press anyway, in the public domain for recruitment purposes. But it's not that it's a preference to use agency. It's to support the existing workforce, to sustain the care, and also not to put additional demands on the contracted staff that we have so that their work-life balance is maintained as well.
Yeah, thanks for that, Emma. And again, it's back to my earlier point that, some of the IGB papers aren't shared with the few of us that aren't on the IGB or on this board, so it'll be good to have that. The other one I was going to ask to add on is that some years ago we had the same issue with home care where we're trying to make a recruitment drive for young people to come into the service. Are we doing a lot of work at the moment trying to recruit young people, or what age demographic are our home care? Because I know some of the home carers are, quite elderly in some areas, and it could be a challenge for us going forward where we're struggling to recruit young people.
Yes, we are. The recent careers fair, Care at Home, were represented there, engaging directly with the potential future workforce. But that alone can't be the answer. And our demographics, probably since you've been on the IGB, haven't changed significantly. You'll see the socio-economic report that comes out from the colleagues in development services. It repeats, what the projections were. So in terms of our recruitment and retention and our workforce strategy, it encompasses all that. It encompasses attracting people from school into the workforce. We have apprenticeships and we have career pathways, the grade on entry. You do your qualifications, there's a different grade, then you move up a grade. But we also need to factor in some career changing, so people who are not just left school, who maybe are employment in another sector, if they wish to enter care, that we be able to hold their hand and introduce them to the service and make it a positive transition for them. And we're also pursuing pathways. If you came into work in care, at the moment you can go on as in Mr. Stewart's service. We have apprentice social workers. You can train as a nurse on Eilean, to expand that to allied health professionals. So that's your physios, OTs, so that people wouldn't have to leave the islands to gain these undergraduate qualifications. So that's the type of workforce planning we're doing. And there's, that's not all within our own gift, but we're pursuing that through the appropriate channels and reinforcing it through, for example, it's in the Islands plan, it's in the allied health professionals, workforce plans nationally. That career progression through distance learning opportunities is something that we want to achieve, to put allied health professionals on the same footing as nursing and social work, for example. So that would, afford somebody who comes into the care to have a range of options. It'll attract some, but some people want to work in care because they enjoy working in care. And there's a programme that's going to be coming out that we supported in the next month that's about care. It's a 3-part programme, and I think there'll be some comms around it when it's launched. Watching that will reinforce the value of working in care for both the cared for, the volunteer or the paid staff member and the family member. So I think in terms of publicising the career that we can offer through care, that the 3-part programme will be very, very beneficial. And it involves people from throughout the islands.
Thanks for that. Thank you.
Duncan, sorry.
Thanks, Chair. Just, commending Michael on the report that he's delivered, on his first year, in post there. And I think we have to look at the success that we have had in social work in particular, and training our own. And we're seeing, after training them, that they are staying on the island. And I think that's very, useful way of training your own and making sure that once they're qualified, that there is opportunities for them. And certainly, you know, as a very small kind of department, you know, they're punching well above their weight, you know, with the challenges that they are facing. And I think we have to be thankful for the training program that has been developed and delivered to allow them to train to be social workers, and that there is a job at the end of the day, because rather than many other island authorities, they're finding it very challenging to have a full complement of social workers. So we have to be very, very thoughtful of, you know, the progression system and the training programs we do have ourselves, and commend the staff on what they've developed.
Thank you, Duncan. Is there anyone else? No more takers. Well, thank you very much for attending. Thank you to Michael and Emma for your reports on that. Oh, sorry, of course, and to formally note the report. Thank you.